COVID-19 is transmitted through droplets or direct contact and infects the respiratory tract, resulting in pneumonia in most of the cases and acute respiratory distress syndrome in about 15% of the cases. Mortality in COVID-19 patients has been linked to the presence of the cytokine storm induced by the virus. Excessive production of pro-inflammatory cytokines leads to acute respiratory distress syndrome aggravation and widespread tissue damage, resulting in multi-organ failure and death. The host immune response to the SARS-CoV-2 virus is hyperactive, resulting in an excessive inflammatory reaction. Several studies analyzing cytokine profiles from COVID-19 patients suggested that the cytokine storm correlated directly with lung injury, multi-organ failure, and unfavorable prognosis of severe COVID-19. Cytokines are an essential part of the inflammatory process. Cytokines are produced by several immune cells, including the innate macrophages, dendritic cells, natural killer cells, and the adaptive T and B lymphocytes. Three of the most important pro-inflammatory cytokines of the innate immune response are interleukin-1, tumor necrosis factor alpha, and interleukin-6. This increase in cytokines results in influx of various immune cells such as macrophages, neutrophils, and T cells from the circulation into the site of infection, with destructive effects on human tissue, resulting from destabilization of endothelial cell-to-cell interactions, damage of vascular barrier, capillary damage, diffuse alveolar damage, multi-organ failure, and ultimately death. Lung injury is one consequence of the cytokine storm that can progress into acute lung injury, or its more severe form, acute respiratory distress syndrome. Acute respiratory distress syndrome leading to low oxygen saturation levels is a major cause of mortality in COVID-19. Although the exact mechanism of acute respiratory distress syndrome in COVID-19 patients is not fully understood, the excessive production of pro-inflammatory cytokines is considered to be one of the major contributing factors. Hence, targeting cytokines during the management of COVID-19 patients could improve survival rates and reduce mortality. A multi-center retrospective study of 150 COVID-19 patients in China reported significantly higher levels of interleukin-6 in mortality cases than resolving cases. And several other cases have reported that interleukin-6 were significantly higher in severe cases. Several biological agents targeting cytokines have been proposed for treating cytokine storm. Tocilizumab is a monoclonal antibody against interleukin-6 receptor that is used to treat certain inflammatory diseases. Better outcomes in patients with severe COVID-19 pneumonia who received tocilizumab have been observed in case reports and showed a rapid reduction in fever, a reduced use of oxygen support and mechanical ventilation, and a reduction in lung manifestations. But it is important to test patient procalcitonin level to clear the risk for bacterial co-infection in COVID-19 patients. Procalcitonin is a widely used biomarker which is used to assess the risk of bacterial infection, where increased concentration observed in bacterial infection and to a far lesser extent in systemic viral infections. When a COVID-19 patient with bacterial co-infection or higher serum procalcitonin level is treated with tocilizumab, patient's interleukin-6 activity will reduce and its ability to fight against a bacterial infection will eliminated. Hence, COVID-19 patients' health will be worsened due to bacterial infection and may lead to death. So it is important to monitor procalcitonin level of the patient prior administrating tocilizumab for COVID-19 patients.